Patient advocates say healthcare safety starts with you, the patient.
This comes one day after an announcement that a former Dean Clinic nurse put thousands at risk for blood-borne diseases. News 3's Theo Keith is answering your questions about this case, and there's a lot of them, Theo.
There are, Susan. This nurse was trained, she was licensed, she was supposed to know the rules. After our story aired last night, we got a lot of questions from viewers, like, where were the state inspectors? We found there are no inspections over individual nurse performance.
Yes, yesterday was scary, absolutely.
Patient advocate Jesse Hirsch has lots of questions after a former Dean Clinic nurse's actions put patients at risk. News 3 found there aren't any state inspectors overseeing those practices, which is why they went unnoticed for 5 years. Federal regulators do inspect healthcare facilities for workplace and patient safety, but not individual nurses. A Department of Safety and Professional Services spokesman says once a nurse is licensed, it's up to him or her to follow the rules. And on Monday, Dean Clinic said it didn't check up on the nurse either.
Was there not any supervision for 5 years of this particular person with the expectation that she would use things the proper way?
Most healthcare providers who are licensed and credentialed this way see patients on a one-on-one basis in the exam room.
Clinic administrators say the technique was basic. The nurse was trained on testing devices like these. But if there's no oversight, patients in the exam room are the last line of defense.
They have to ask questions. That is the biggie. You have to ask questions. And don't be intimidated by somebody. Get your answer. You deserve to have those answers.
We asked Hirsch how the diabetes patients in this case who were learning to use those testing devices for the first time could have known any better.
That is a situation I'm sure that would be very hard to know, because you would make the assumption that this would all be okay.
The nurse isn't with Dean anymore. In a statement, a spokesman for the state's licensing agency says it's opened an investigation, but he couldn't comment beyond that. Hirsch says you shouldn't judge the whole industry by a few mistakes.
It is important to trust your provider. That I will say. If you don't have somebody you trust, then you need to find somebody you do trust.
One other question we got yesterday, why did Dean wait 3 weeks to go public? They say they wanted to make sure they had the right information and the right patients. We want to reiterate this again. If you don't get a letter or phone call, you're not at risk, they say. And even if you are contacted, Dean administrators say your risk is low.
Story will continue to follow. Theo Keith reporting. Thanks, Theo.